stuff going out on the blogs and on the internet. Oh, look, we had to do this because the Democrats were going to cover non-citizens, which was never the truth. And so people just said, you know what, this is serious business. And we're not playing these games anymore. There's a lot to do, and so that's where that discussion came from. And I can get you the supporting documentation for that from my office. It's for this is for citizens and citizens only.
Hi, I'm Jean Sanford. I'm from St. Paul, Minnesota, and all this really boils down to money. I was on Medicare for 8 days when I got a notice from Blue Cross that my supplemental was going up 12%. And my son and his wife were laid off from their job and went for about 3-4 months without any health insurance until someone got into their job. One of the things that I've seen a lot, people think and imagine that we can use Medicare as a model. Medicare is a great model, I think, but it all comes down to money. The people that serve Medicare patients and Medicaid patients, the nurses, the hospitals, all have to take a write-off for it. The amount that's paid presently for Medicare and Medicaid do not cover floor space, salaries, not to say taking something home in the doctor's pocket if they're a single practitioner. Something has to be done to fix this, and it might be a good model, but it has to raise the salaries. They have to increase the payments. Thank you.
And thank you. And that's what I've been working on. In fact, I've made it very clear that should a public option move forward, that we're not, I'm not going to be looking at basing that at the inadequate way in which our physicians and healthcare systems are reimbursed by Medicare here in Minnesota. It's unfair, it's not right, and it's simply not sustainable for our healthcare system. So I know a lot of people in Minnesota understand that, and I know that I appreciate you bringing that up, and I know our doctors and healthcare systems are happy to have advocates like you out there reminding me that this needs to be fixed.
$42, $264, and $90.
Yeah, thanks for holding this town meeting. I really appreciate that. Representative McCollum. My name is Bob Hindle. I live in St. Paul, and I've been very interested to hear your comments. Of course, I appreciate your work and the work of all people in Congress, and I think democracy is the greatest thing on the face of the planet in terms of government, and you're making that possible with your service. I thank you for that. However, I am a little bit concerned by your claims of transparency. Let's take a little look here. Obama talked about initially this healthcare plan would pay for itself. And a few weeks or a few months later, we're hearing it's going to cost $1 trillion. Where did the transparency go there? The bill is about 1,000 pages long. If you take the time to look at it on the internet, and most congressmen and women have not read it. Notably, John Conyers, interestingly, said, hey, I can't read this thing. I need lawyers to figure out what's in this bill. If you take the time to actually look at it, it's not intelligible by and large. What happened to the transparency there? And then, of course, there's the question of Obama's great claim that this is going to ultimately solve our economic problems, where we're, $2 trillion more in debt after his great policies than he claimed that we would be. His various promises of changing unemployment, and now we're 10%, and he said it wouldn't go above 8%, now it's 10%. All these things, the question of transparency is totally lost on me. Here's my recommendation. First off, I think it's extremely unproductive to talk about the Republicans blocking this thing. I'm an independent. I detest this bill. I don't have a lot of time for the Republicans. I have less time for the Democrats. I think there's a lot of pathological lying going on in this debate. I think we need to take a lot of time to do this right, as that gentleman said back there. The second thing I think that should happen is there should be a real concern about cost. We're in an economic crisis today. We're not primarily in a healthcare crisis. We're in an economic crisis. So much so that the Chinese are advising us how to run our economy. That's a disgrace. We need to get real about solving our economic problems, getting people back to work, getting the country solid. And then we can talk about healthcare. Thank you very much.
$205, $150, and $9.
And I live in St. Paul. My background is I used to be a nurse. I'm retired now. And one of my concerns, and I hate speaking in public, is that what I don't hear in this is about how we as a society really are affected when 40,000 people, or 40 million people, do not have health care insurance. Right now we have really serious things coming into our population. One of them is TB that's resistant to antibiotics. Another is, just an example, the swine flu, which can become an epidemic. If we have people who are living in a way that they're not getting basic health care, that's putting me at risk and every one of you at risk. We need to make sure that people in this country, whether they're citizens or not citizens, non-citizens can carry these terrible organisms too. We, for our own sake, whether we're Republican, Democrat, Conservative, Independent, mothers, children, we need to protect ourselves with a better healthcare system.
Let's save it all for the end so we can get more questions in.
Good evening, Representative. My name is Scott Hartwick, and I'm going to quickly tell you a story about my father-in-law. We lost him 2 years ago. He was 58 years young, and he was fortunate. He was a bit of a hypochondriac, and he had a Cadillac health insurance policy that provided all coverage for him, and fortunately for our family and my mother-in-law, things worked out well there. But within 4.5 months of being diagnosed with brain cancer and due to some very serious complications, his expenses approached $2 million in costs. So many people here think they've got a good health insurance policy. My wife, her employer provides us with a policy we contribute towards, and we have $1 million caps. And if either of us had contracted that same illness, it would have broken our household. And without changes, without the reforms we need here, there's a lot of us here that think we've got good health care. We really don't. We don't have enough to deal with the problems that can arise.